Welcome back, viewers. This is Chungu cha Jamii. On the show, we've brought a guest who is helping us to understand about cervical cancer. This is the Cervical Cancer Awareness Month, and it is time that we learn about cervical cancer. What are the causes? What are the symptoms? Dr. Alexander is helping us to understand on how to learn our body, how to go for checkups, how to go for screening, how to go for vaccine, and who are at risk and who are not. Before we went on a break, Dr. Alexander, I had asked you about those that are symptoms and are at risk of this, and we've said that the lineage of people who have cancer. Mm-hmm. So if I have cancer, if I'm not having cancer and I'm from a lineage of people who are having cancer, what makes me to be at risk of getting the same? And how is it related when it's, say, genetically?
Yeah, so I'd mentioned before that, especially for some cancers, and this, for example, we see in ovarian cancer, breast cancer, we have seen that if you have someone who's a first-degree relative, that is your mom, your sister, your grandmother, if they've had it before, there's an increased risk of you having it. We haven't seen so much in cervical cancer, that risk, because as I said, most of us are alluding it to it's a sexually transmitted cancer, in quotes, if I can use that word. Mm-hmm. So we per se, of course, the genes come and play, but I was saying more, we've seen it especially for now when it comes to treatment, that of course not everyone will respond the same way. You'll find someone who will respond better, and this could just be because their genetic buildup is a bit better, different, as compared to someone who also has the same type of cancer, but is also getting the same sort of treatment. Mm-hmm. Yes.
With this, our society.
Yes.
How educated are we about this cervical cancer?
Of course, we are not very educated. I mean, the fact, what I think has brought this about is because also one, that when we lost a very prominent high-profile journalist last year, as a regard, and this was, and we lost her to cervical cancer. Now this at least now started, we noticed that especially on social media, a lot of people started asking a lot of questions about it. Can I be screened? What are the symptoms? What happens when if I am found to have cervical cancer? What next? And so we really like that interaction and that engagement. But we notice, of course, that there's a lot of paucity of information. People are not able to readily access it, and even then, where do they go to access it in a way that it can be disseminated, that it's user-friendly? Not necessarily just for us who are the medics, but at least even if someone wanted to just go and get the key highlights about cervical cancer, where can they go to get that information? Mm-hmm. And even now I've noticed that if you go even to the Ministry of Health page on Facebook, they have really simplified it, just trying to put key messages. What are the take-home points that you should be able to get, so that when you're able to read it, you don't look at it like this big amorphous topic, but you're able to know what is it, what are the signs, what are the symptoms, what are the basic modalities for screening, treatment, etc. like that. Mm-hmm. Yeah.
I've heard of the vaccine of the young girls.
Yes.
Is it only for the young girls, or it is for women generally? And is it from what age?
Okay, so now that you brought up such a good aspect of this discussion, so the vaccination is one of the prongs that we use for treatment, or rather for prevention of cervical cancer. So it was noted that, again, this is an age group that if you ignore, these are the same girls who will grow up and get exposed to HPV and then later come up with this with infection, and later possibly may develop the cancer. So they were targeted, and the whole point of it was prevent especially as they are not sexually active, prevent the infection of the HPV. Yes, so that's the whole point. And how a vaccine works is you expose the body to a bit of the infection, which is the virus, and it's able to mount antibodies, so that in the event, let's say now, these young girls get sexually active, their body is able to clear that infection even before it gets to the cervix and infects the cervix. So that was the whole idea behind it. So the age, of course, now they targeted young girls from the age of 9 to 14, but you can even go as high as actually 9 to 26. And if you look at countries like the US and other more developed countries, they're actually now not only saying young girls, but young boys as well. Yes.
Okay, given said that,
Yeah.
according to your statistics and given that you're in that field,
Yeah.
how are the response in terms of now the vaccine? Are the young ones, or are the parents bringing the young girls for the vaccine? And now that you're mentioning about bringing boys on board, are they coming for information about the boys, and for the girls, are they getting vaccine at a big number, or is it just one?
You know, that's a very interesting question, because this program has actually been there for a while. It's not like it just started now. But initially when it started, I think it started like in 2019 or 2018 thereabouts. But when it started, there was a lot of resistance, because, you know, a lot of parents were like, look, you're basically now giving the green card to my young girl or my young boy, in that case the young girl, to engage in sex. But we were like, no, that is not the message we're carrying. We're trying to actually prevent them, so that when they are ready and they do begin having sex, they're actually protected from getting HPV. But as I said, this whole discussion, and especially when that high-profile journalist passed on from cervical cancer, then it was now a lot of questions, because I remember I was even on my social media handles, and a lot of people are asking me questions like, when can I get the vaccine? Can we vaccinate my little girl? And how do we prevent it? Can she come for screening? So that's when people began to realize that. And even if you look at studies, because studies have been carried out among the girls or the cohort that was vaccinated and looking at their sexual debut, not much has changed. So they're actually realizing that get the young girls vaccinated, protect them, and then they'll be ready to go. Now you'll be dealing with another issue altogether, not necessarily cervical cancer.
So on the issue of the same about vaccine, is it a one-time dose, or does it have different dosage?
Okay, now there are two vaccines. There's one called Cervix, there's one called Gardasil. So Cervix you inject twice, 6 months apart. The other one you give 3 times. So you'll give maybe at 0, you give after 6 months, and you give at 12 months. So there are two types, and it all depends also on the cost. Because Gardasil, the one with now Gardasil, is a little bit better because it protects you against 4 strains. Basically, in cervical cancer, if you look at the strains that cause the most cervical cancer, it's 16 and 18, which are covered in the Gardasil. I mean, in the Cervix vaccine. But remember, there are also other strains that can cover, like 31, I think 43, 50, 52. Those are the ones that have been still noted to cause cancer. So now, the Gardasil has expanded coverage. So it has also against 6, 11, 16 and 18. Because also, it's not like that Gardasil is not only protecting you against the cancer, but also protecting you against other what we call genital warts, because again the HPV can also cause warts on the genitals, not only not only causing cervical cancer. And now there's even a newer vaccine that has come out, but it's not available. Okay, locally I don't think it's available, but I've seen it being marketed in the US. There's one which actually protects against 9 strains called Gardasil 9. Yes, so that will protect against a wide range, so that literally when they get that vaccine, issues of genital warts, oral cancers, because HPV can cause a wide range of things, penile, and you see that's why we say we have to protect the boys, because it will protect them against penile cancer, oral cancers, the genital warts, and our women against cervical cancer. Yeah.
With this vaccination,
Yes.
we'll find that even with other injections, when you're being vaccinated, you'll find that different people have different, should we call them reaction towards the vaccine or the side effects? What are some of these side effects that one should look out for, or one, especially for these young girls? You'll find that if I've taken my daughter for the vaccine and I also don't have the full information about it. So what are some of the side effects after the injection that maybe she'll come and tell me, Mommy, I'm feeling this and this.
Of
and
course.
maybe
Basically, it can range. You can range from 0 side effects to now side effects where you have a fever. Because remember, as I told you, how does a vaccine work? You want to stimulate your immune system. So sometimes some people have an exaggerated response. They may have some itchiness, some scratching, some fever. They may also now actually react now depending to the allergy. They may have some various degrees of allergic reaction depending on the agents that were used in reconstituting that vaccine. So the most important thing we always tell our patients is that please monitor, especially between the first 12 hours, so that in case of anything, if you get any of these symptoms, please come back to the facility for assistance.
so the symptoms is itching and
Itching, fever, headache. They could also have like some allergic reaction. Like I've been seeing one which was rare. They had some sort of skin rash or something. You know, those are the mild ones. But some have actually potentially have had very severe where they have actually needed to be admitted in hospital. But it's very rare. It's not a common occurrence. Yeah.
for a young girl
Yeah.
who is transiting from being a young girl and now maybe to the puberty stage, or
Yes.
now starting now also receiving menses and what have you. Another concern may be, because I've seen different people with same question
Yes.
about how do I put it, not discharge per se, but the foul smell from this young girl. So how do we put it now? Is it an alarm for one to be taken to the hospital, or is it normal because of transiting from being a young girl now to the young woman that she is?
So I've noted that especially not even that at that age, but from now like when young girls actually are starting school or are transiting into high school, because again, it's now, I know we're deviating a little bit, but this is where they should be taught about things like menstrual hygiene, how to keep clean. But again, you should always rope in a health provider, because, you know, like going back to cervical cancer, some patients come with this like they just keep on being treated. You keep giving the treatment for this STI, treatment for this STI, or treatment for this discharge. And actually, when you examine, you find there's a huge like mass or swelling on the cervix, that there's actually something going on. And if you didn't examine, you would never have known. So that's why I said it's always important to rope in your healthcare provider, because they have a better index of suspicion, and they'll be able to grade and think and look at the risk profile and I think adequately fit where this patient belongs.
Wow. And when you say about menstrual hygiene, you'll find that with our lifestyle currently, as young as 9 years old, as young as 10-year-old girl is having her periods. Now, one would feel she's too young even to understand about her hygiene as per se. How now, when you say that we rope along a doctor in this, how do I now educate this young girl, assuming it's my daughter that is going through that? And when I'm educating her, I'm also seeing the child in her. She's still up and about. She doesn't understand all things. It's all new to her. How now do I bring it to her for her to accept herself and not feeling that now I'm being, do I say ambushed, or being pushed to being a grown-up all of a sudden, and I'm not ready for it?
Yeah, I think you just have to have a candid conversation with especially our young girls. The reason is because nowadays, actually puberty is starting off early as compared to our ancestors. So it used to start around 13, 14. We're actually starting puberty at 8, 9. Of course, if it's starting earlier than 8, then we call it precocious puberty, and we need to investigate, because usually there's a disease process underlying that. So we need to just sit down our young girls, daughters, and actually tell them that you will start to notice this. You will start to notice, of course, your hormones maybe start raging. You may start noticing your breasts become bigger. You'll start noticing that you may start bleeding, and this is what you need to do. You might start sweating. You'll start growing hair. So that you now treat them and tell them that this means these are the implications. And as a result of that, you need to now take better care of yourself in this way. Yeah.
Wow. Easier said than done.
Yeah.
But again, now we are running out of time.
Yes.
Could you give us a parting shot
Okay.
of this topic?
For me, thank you for having me, first of all. But for me, I'm just going to say this, that this is one cancer that if we are aggressive, it is actually preventable. And how do we become aggressive? Number one, let's be aggressive with the knowledge. Let's propagate this knowledge out there in a way that people are able to understand. And how do they understand? Things like just from what are the symptoms, what is expected of you when you go to your healthcare provider, how do we diagnose, how do we screen, if we find you positive, what are the various treatment methods, and how do we get treatment. The other thing that we can also need to do is that this is the emphasis of risk stratification. All those patients who are at high risk, let's actively screen, so that we're able to get them early and we're able to intervene. And the third thing is let's vaccinate. Let's have an open mind and vaccinate as much as possible to vaccinate our young girls, vaccinate also our young boys as well. Let's rope in the boys into the vaccination process.
Thank you so much, Dr. Alexander, for honoring our call and for coming in and enlightening us with all this information about cervical cancer. Viewers, I hope you've learned a lot from Dr. Alexander about this topic, cervical cancer. We've learned that we should also rope in our boys. We should not sideline them saying this is only a girl child issue, but we should bring them on board because them also are at risk and them also are carriers of the same if they are not well taken care of. I hope you've taken notes. I hope you've learned a lot. Continue sending in your questions, your comments. Let's continue this conversation across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. Thank you for staying tuned till this time. See you next time. Bye-bye.